the urine HCG pregnancy test and it showed that she is pregnant. And when she went to hospital for an ultrasound scan, the ultrasound scan showed that the pregnancy is there, the baby sac is there, but there's no baby inside. There's no fetus inside. There's no live embryo inside. She is asking herself, what could actually be the problem? Why is it that she is pregnant? The pregnancy test, the urine HCG pregnancy test is confirming this. She is pregnant. She got the 2 lines. But on doing an ultrasound scan, there's no baby inside the baby sac. What could be happening? This is what is known as an embryonic pregnancy. It is what is known as a blighted ovum. You can call this an embryonic pregnancy. You can call this a blighted ovum. Blighted ovums or an embryonic pregnancies originate as a result of many factors. The first reason as to why many women are getting blighted ovums or an embryonic pregnancies, empty baby sacs, could actually be connected with what we call chromosomal abnormalities. When I talk about chromosomes, specifically when you take a closer look at the male sperm. So when you take a closer look at the male sperm, it has different parts. It has the head of the sperm, there's that part known as the neck of the sperm, and of course the tail of the sperm. And the tail is what propels this sperm to move the whole way through the womb and then of course up to the fallopian tubes, assuming that the fallopian tubes are open. The fallopian tubes, if they are open, the sperms will pass through, or the male sperm will pass through to the egg, also known as the dominant follicle. This egg would actually be already in the side of the fallopian tube, known as the ampullary part of the fallopian tube. When this male sperm reaches the female egg, it's actually going to penetrate the female egg, and then of course this is a result of a chemical that is on the head of the male sperm, and this chemical is what is known as the acrosome. When this sperm enters the female egg, there's going to be fusion, there's going to be joining of the DNA inside the male sperm with the DNA inside the female egg. We know very well that this mature egg that is going to be fertilized also has 23 chromosomes. And remember, I've said that chromosomes are basically the genetic material of a person. The genetic material, it's basically what makes up the DNA. And remember, the DNA is where all the information about an individual is embedded. So we have 23 chromosomes from the male sperm. We have 23 chromosomes inside the woman's egg. It is basically these 23 chromosomes that will fuse or that will join with the 23 chromosomes from the male sperm, and when we get 23 from the man and 23 from the woman, we end up with 46 chromosomes. These 46 chromosomes are what makes up a complete person, what make up a complete fertilized egg. Now, assuming that this egg has been fertilized, it is having 46 chromosomes. It will move, or it will begin on its journey through the fallopian tube, back to the wall of the uterus, back to the endometrium. Assuming that the fallopian tubes are open, assuming that the fallopian tubes are patent, they are clean. But if at all this fertilized egg is on its way, going to the endometrium, and then along the way the fallopian tubes are blocked, blockage could actually be due to fluid collections, blockage could actually be due to adhesions, scar tissue in the fallopian tubes. Then this fertilized egg would remain in the fallopian tubes, leading to what we call an ectopic pregnancy, leading to what is known as an extrauterine pregnancy. The main point or the main reason for this video is how does, or what could actually lead to a blighted ovum. I was narrating this so that we could get the background information about everything, about fertility, about fertilization, and about an embryonic pregnancy. I was saying that if the sperm is healthy, it will be having 23 chromosomes. And if the woman's egg is also healthy, the dominant egg, if it's also healthy, then it should also be having 23 chromosomes. As a woman makes 35 years onwards, going to her 40s, going to her 45, there's going to be changes in the quality of her eggs. You realize that as a woman is aging, the quality of her eggs is going to actually change. They could deteriorate or they could reduce in their quality. This actually begins from the womb when the baby is still in the womb at around 20 weeks, at around 4 months. The baby would be having 6 to 7 million follicles, 6 to 7 million eggs. But as the baby has been born, just immediately a baby is born like this, she would be remaining with 1 to 2 million eggs. From 6 to 7, she will be having 1 to 2 million eggs. And as she's making puberty, she's beginning to see her first periods, she would be remaining with 200,000 follicles, 200,000 eggs to 300,000 eggs. This is according to the National Institute of Health, that is the NIH in the US. So studies were done and it was discovered that as a girl is growing, as a woman is advancing in age, there's going to be deterioration or there's going to be a reduction in the quality of their eggs, and this is actually what is known as a treasure of the eggs. It's actually what is known as apoptosis. Your doctor could say that your eggs are undergoing apoptosis or your eggs have undergone atresia. He or she means that your eggs would have reduced in their quality, and this is nature. You do not need to blame yourself as a woman that maybe you are different from other women. No, it is nature. All women undergo this process. Also, some of these deficiencies, when you go to hospital for a proper checkup, when you go and consult your doctor, a doctor near you, your doctor would take you through all this and run the proper tests on you, and then treatment can be given to you. Remember, you can get pregnant. If you have been trying to get pregnant but you are not getting pregnant, you need to go to a hospital near you, talk to your doctor. Your doctor will look for the probable causes of why you are not getting pregnant. It could be a female factor issue, it could be a male factor issue. And then of course, once the reason has been identified, then of course solutions would be recommended by your doctor, and I do believe by the grace of God you can get pregnant. We are talking about an embryonic pregnancy, and I was saying that embryonic pregnancies do come as a result of reduced quality in a woman's egg, reduced quality in a male sperm. Because for a baby to form, it is a well-known fact that there should be joining of the male sperm with the female egg. So if the quality of the male sperm has been reduced or it has gone down, then there are high chances or there's a big risk that a woman could end up with a blighted ovum. Remember, a blighted ovum could also be brought about by environmental factors. Talking about environmental factors, if a person, a man or a woman, has been exposed to toxins, we call these toxins, they could actually be fumes. Maybe they are working in a place where there are lots of toxins, lots of chemicals being inhaled on a daily basis. Then these chemicals could assimilate, these chemicals could mix with their blood, and of course remember that the man has what we call the testis, which actually contains special cells known as the Sertoli cells and the Leydig cells. These are cells that are responsible for the whole process of sperm production. If the blood supply to these specific cells, if the blood supply to the man's testes, that is basically to the areas responsible for sperm production, these include the Sertoli and the Leydig cells. If the blood coming to those cells is actually filled up with toxins being inhaled as this man is maybe exposed to this environment, as this man is smoking cigarette after cigarette, then it could actually affect the quality of the final product, the quality of the sperms that are going to be released.